This is Mark Hill, the Traveling NP. Just finished a 6-day rotation in Poplar, Montana, in the emergency room there. 6 24-hour shifts. Now I am driving about 6.5 hours over to Cooperstown, North Dakota, to do 5 24-hour shifts over there on call in their ER. And wanted to dedicate this video to people who are considering doing emergency room work, especially out here in the rural areas.
Head east on US 2 East.
I am currently, I'm just left Williston, North Dakota. It's 15 below zero. The sky is very clear, as you can see. Road is clear, but there's a lot of snow on the ground. Very cold. I had a good rotation in Poplar. It's about a 12-bed acute care hospital with a 4-bed ER trauma room. It's in the middle of a Fort Peck reservation up in the northeastern part of Montana. Most of the clientele with this ER, probably 95% of them, were Native American. This hospital kind of serves as the IHS of Fort Peck. So you get a lot of Indians coming in, a lot of health issues, a lot of chronic health issues, and a lot of traumatic injury, violent population, a lot of alcohol abuse, drug abuse, things of that nature. Saw some interesting cases. Had to intubate one gentleman for respiratory failure, new onset seizures. Apparently fell and hit his head, stopped breathing. Intubated him and put him on a plane to Billings, Montana, Billings Clinic. It's about 370 miles away. That's your closest big hospital, your tertiary hospital. So everything has to fly out from these little hospitals. Had to fly another lady out. She was in cholecystitis, on the verge of being septic. She had a white count of 27,000. Total bilirubin was 9. So she was getting sick. She couldn't wait. She had to go. And had another lady came in, found down on the floor. Severe anemia, hypovolemia. She got to the emergency room. She had a blood pressure of 70 over 20. She had an H&H of 5 and 16. We held her. I admitted her to the hospital there. We gave her 3 units of blood and a lot of fluid and got her stabilized. And she was leaving this morning to go have a EGD and colonoscopy. She had guaiac positive stools. So yeah, I got to see some interesting stuff, and a lot of clinic type stuff, but also, a lot of young babies coming in, upper respiratory symptoms, wheezing, several pneumonias, things like that. One good thing about this hospital is they do a nursing medical screening out. So if a patient comes in for, bogus reasons, the nurses will med screen them out. They'll come tell me, look, I got this person came in for tooth pain or something like that at 10 o'clock at night. And they just med screen them out and I don't have to see them. So that makes my job a little easier. Makes it to where I don't have to stay up all night long dealing with, non-emergent issues. The beauty of these ER gigs out here in the middle of nowhere is that typically the pay is good. And you're not working all that hard, but it can be difficult at times. sleep deprivation can become a problem. I didn't get a ton of sleep over the last couple days, 2 hours here, 2 hours there, things like that. So it can be challenging from that standpoint. There's a lot of autonomy. I'm the only provider in the hospital, so whatever comes to the door, you have to deal with. If somebody comes in with a collapsed lung, gaping chest wound, abdominal wounds, if they're coding, you as the nurse practitioner or the PA, you've got to deal with it. You got to handle it. So when you take these jobs, you got to get your mind wrapped around the knowledge that you're it. There's nobody else to help you. There's no backup. There's the closest next hospital to us was 35 miles away, and there was a nurse practitioner there too. So it's not like I got any backup. Your ambulance service is not staffed with paramedics. They're all basics, so they're not instituting any treatment prior to getting to the emergency room. So their objective is to get the patient there as fast as possible, which, you know, no treatment prior to the emergency room can result in poor outcomes. So yeah, it's an interesting way to do things, interesting way to work, and the money's good. I contracted this contract for $2,000 a day, so it's not really an hourly rate. They pay me $2,000 a day to staff the ER, and then they provide in-hospital housing, and then a rental car and flight to Williston, North Dakota. And they feed me 3 meals a day plus snacks, whatever I want to eat. So it's a good setup. And so I finished out that assignment this morning at 8 o'clock. And now I'm headed 6.5 hours east over to Cooperstown, North Dakota for a 5-day stretch over there. Typically this hospital is a little slower. They don't have the Indian health population. So I'll be on call there for 5 days through the first of the year. And they put me up in the hospital as well there. Adequate accommodations, feed me, and so then I'll go home. When I finish out the morning of the 2nd, I will drive back to Williston, North Dakota, and fly home for about 16 to 17 days and be off. And then during that time, I'll just do my telemed stuff. And I've got another assignment set up for towards the end of the month. I think I fly back up on the 19th or the 20th for about 12 days. So just a little insight into how I do things up here in the Great White North, and you know, what I'm doing and how I'm doing it. And so people who are interested in this type of work and this line of work can get an idea of what you're looking at and what kind of patients you're seeing, and how you can manage your time and manage your rotations. And you know, a lot of it's just flexibility, where you're willing to go, what you're willing to do, and of course your experience level. So anyway, I got a buddy of mine that follows on YouTube, said he was anxiously awaiting a video. So Paul, here's your video. Paul, won't give out last names, but Paul came and shadowed me while I was at the urgent care in Moses Lake, Washington. He's a nurse practitioner student that looked me up through my YouTube videos, and he came, spent the day with me, and got a chance to see how I do things in the urgent care setting. And Paul's a great guy. I'll be a good nurse practitioner, so I'm anxious to hear how his career unfolds. Anyway, this is Mark Hill, the traveling NP, headed to my next assignment. If you have any questions, any concerns, anything you want to talk about, let me know, and I'll get to everything as fast as I can. Anyway, till next time, have a great day.